the workforce. And really want to, our overarching objective is to fill these open positions by developing career pathways that can provide higher paying jobs, thereby increasing family income and lifting families out of poverty. These are really the intent of these ARPA dollars. And so the home care agencies and SNFs will hire and or employ these candidates. They will sponsor these candidates in additional training that's needed, as well as retain these candidates, whether in their training period or post-training, by providing whatever needed wraparound support these candidates may need, mentorship, and other services. And so I want to just stress again the importance of collaboration in this program, in that we feel collaboration amongst different organizations will allow us to be successful in achieving our goals under the program. And so Christina will just briefly talk about what these collaborations will foster, and some very specifics around what we envision this collaboration to provide. So Christina.
Thank you so much, Catherine, and good afternoon, everybody. As Catherine stated, this is really about collaboration, and these organizations that we're all collaborating with can provide for several different services. They can connect job seekers to employment opportunities. So we're working with some organizations that can help on the recruitment side of things. They can also help by sharing information and resources, including funding opportunities to support continued education, training, and certification programs. Specifically, we outlined in our last webinar how Rochester Works is supporting us in that capacity. And thirdly, and this really gets to what Anne-Marie is here to present upon today, is providing employment and workforce development services, such as career skills training and resume building. And with that, I'd like to introduce Anne-Marie Shepard, a founder and executive director of AVS Consulting Strategies. Anne-Marie, welcome.
Thank you so much, Christina. Good afternoon, everybody. My name is Anne-Marie Shepard, and I am the founder of AVS Consulting Strategies, which is really dedicated to all things workforce development. My background is education. I was a high school teacher to seniors for 15 years before I transitioned into starting this business. And one of the things that I had noticed in my last few years teaching was a lack of understanding of what it meant to be a professional. Students had zero idea about the need for a resume or interview skills. I had several students who had no understanding of why I would make them put a resume together based on the skills that they had already for going into college. And I was explaining, because we pushed college at the school that I taught at. And I was explaining to them, situations change. You may need a job while you're in college. You may be in college for a semester or a year or two and decide that you want to take time off, but you're going to need an income. And in order to do that, you're going to need to interview, and you're going to have a resume in order to even get to the interview stage. And what I realized, not just for the students that I had, but professionals that I work with, college graduates that I work with, high school graduates that I work with, and even high school students, high schools and colleges really do not do a good job in this area. Content is covered. You can know what you need to know to be confident in your position. However, there's so much more that comes with it. And so I developed a variety of tools to assist people in their journey into being a professional. So this is a horrible slide that I put together. I'm sorry. That does not come across as great as I thought it would. So the first thing that was really important when talking with different organizations that I work with and clients that I've had, what do you feel is missing when you are hiring, when you are looking for a job, that you wish you had a little bit more information on? And so different topics that I cover are professionalism, time management, emotional intelligence, conflict resolution, communication, and cultural competency. And each of those things brings enormous discussion. Whenever I have a workshop, I always try and build in time for conversation around the topic. It's not just a lecture type situation because we've all been in PDs where it's awful, where you have somebody just lecturing. So it's very interactive, and it's interesting how most people have a lot to say based on their experience. So the first thing that I would talk about is professionalism. I think that is the next slide. Okay, there we go. So professionalism covers a lot. It's a very general term. And normally we begin the discussion with how a professional looks. And we all have preconceived notions of what a professional looks like. And interestingly, the clothes don't necessarily make the man, if you will, but it does play a role in perception. And so one of the things that is important with professionalism is knowing your craft, being competent in the area in which you are working. And so that's where the education piece comes in, the professional development, the training when you are onboarded into your particular organization. It is always important to consistently be getting better and developing more skills, whether that's, again, PD classes. They can also be having a conversation with a mentor or somebody who's been around a little bit longer. That is one of the most important things in professionalism, is having the qualification to even be hired. But then developing daily habits, things like your attitude, your work ethic, and everybody's work ethic is a little bit different. That is definitely a conversation that comes up in workshops. What your manager is requiring versus what you think the job description is, there may be a little bit of wiggle room there. It is really important to understand what the expectation is going in and making sure that you are completing that as you go through your day. Being accountable. Oftentimes there is offense that is taken in the workplace because there is an expectation, and the way that it comes across seems critical. But it doesn't mean that you can't cross off your checklist for the day, what you are required to do. The appearance is important. It doesn't matter what the job is. If you are, in a boardroom, if you are working with patients, if you are working with students, there is a look. I tell people all the time, you're not going to see somebody who is a garbage man, a great paying job, by the way, in a three-piece suit. That does not lend itself to the position. However, no matter what the position you have, there is a look, and you need to follow that because you're representing your company as well as yourself. We talk about things like make sure your clothes are ironed, make sure that you don't smell like cigarette smoke, making sure that your perfume or your cologne is not too overwhelming, because those are things that do play a role in how you work with other people, especially in healthcare. We talk about things like eye contact. If you are a professional and you are having a conversation, part of that communication requires eye contact. And in today's age of technology and being on the keyboard, oftentimes those skills of having a conversation and looking somebody in the eye can be taken for granted. And so we do discuss that as well. And then we also talk about HR. One of the biggest things that I stress when we're talking about being a professional is knowing what comes with the job. I am not an HR expert at all, but experience has proven to me time and again, check with HR. What are the rules? What is actually written down in the handbook? Because you are required to follow the rules whether you know them or not. It's the same with the law. And so a rule of thumb is to always check with the employee handbook to see what you should be doing, what you are expected in the event that you need to come in late or you need to take time off. It is really important as a professional that you know all those ins and outs. And so in the professionalism piece, those are areas that we definitely talk about. Okay, we can go to the next one. Time management. This is one of my favorites. I have 4 children and a husband, and they are all very, very busy. And one of the things that I talk about in my personal life is how I can't do a good job in my professional setting if I have not got things scheduled properly. Not that every moment has to be scheduled, but having an idea of what your day looks like helps you prepare. If you have to be to work early, that means that you have to have some things done in advance. You want to make sure that you have gas in the car in order to get to work so you're not getting there late. You want to make sure that in the event of emergency, you have a backup plan for childcare. If you are, I don't know if this is the situation here, but if there are any mandates with time, it is really important that the worker has a really good grasp of how to manage their time, and that will translate into an easier working day. And it'll also translate into the work itself. If you know that you have a patient that you're working with and you have to get certain things done, if you are really good with your time, you'll be able to manage that effectively without being frazzled, not knowing where the tools are that you need to get the job done. So we talk about time management and different tools that there are, whether it's on the phone, whether it's a day planner, whether it's using Google Calendar. There are so many different free tools that just take a little bit of practice that really will help in the job situation. The benefits, of course, having a smooth day. Let's be honest, Mondays are going to Monday, right? They're going to, something is going to pop up. Somebody's going to call in sick. There's going to be a cut that goes flat. Something along those lines is going to happen. And so it is really important that, you stay on top of knowing that that is going to happen. So there are a lot of benefits to that. Barriers to time management. Oh my gosh, there's so many. Procrastination, being a person who never says no to anything. It is okay. I tell people all the time, it is okay to say no in your personal life, and it is okay to say no in your work life. But it is really important that, again, expectations from the beginning so that you know when it is okay to say no. And then different strategies, again, those are the tools that I mentioned earlier that will assist with time management. But I am a big fan of time management. It's something that I started working with my teenagers so that they are ready to go, handling their schedules, and being really accountable for what they're supposed to do. Okay, so the next one, emotional intelligence. It is so critical in any work situation that you know how to interact with people, that you can read the room. And this is oftentimes a skill that is lacking. And in the healthcare field, I've had a lot of conversations with people who work in healthcare that say this is probably one of the most critical skills that a worker can have. When you are working with patients, when you are working with people who are ill, who have had an injury, you have to be able to have things like empathy. You have to be able to carry on a conversation. Those are skills that are really, really important. You are going to walk into a situation where somebody may be angry or scared, and that may come out in a way that seems disrespectful, and yet they still need care. And you have to always remember, what is your motivation? The last workshop I had was with folks who were training to become CNAs. And I asked, what is your motivation for this position? And almost all of them said that they had a grandparent who was pivotal in raising them. And they learned a lot of skills from their grandparents. And they really want to be able to kind of give back in that regard. And I said, okay, well, it's really, really important to remember that when you might be working with somebody who's got dementia or Alzheimer's or something along those lines, and they, forget who you are and they see you every day. It is important on those hard days to remember you're here to give care to somebody who really, really needs what you have to offer. So we talk about all the things that make up emotional intelligence, and then we've had some really interesting conversations about, how you can implement those skills into the workplace. And probably the most important is remember why you're here. Remember, this is a difficult day or a difficult life for somebody that you're working with, and they need you to be at your very best. And so that normally goes over very well. But sometimes it's got to be a daily reminder or an hourly reminder because everybody's got a bad day. So emotional intelligence is one of the things that we go over as well. So bigger than I thought was conflict resolution. In the workshops that I have done in the past year, to those who have participated, conflict resolution has been one of the top 2 topics that goes on and on and on. Folks want to talk about this. And so obviously we go over, well, what is conflict resolution? And even before that, let's identify conflict, because everybody comes from a different background, and how they handle conflict is a result of how they see conflict, what conflict truly is. I grew up in a household that was very loud because my family, my father's background is Italian, and it was a very, very loud household. And other people might look at that like they're crazy. And so we do talk about things like, your background can really impact how you communicate. And it's not that somebody's yelling at you, they're literally just saying hello. So it's really important to identify the conflict and then get into the resolving that conflict. And so reasons to resolve conflict. Number one, you want a peaceful place where you are spending so much time. When you are at work, you should not feel anxiety or concerns about somebody giving you a dirty look or gossiping about you. It is really, really important that when there is an issue, that it is identified and it is talked through and worked out so that you can have a peaceful place in which to live. And then it's also, or I'm sorry, not to live, but to work. And it's also really important that you can see other people's perspectives. That is a really important state, not just in life, but in work. You are going to be working with people. Therefore, you're going to have different perspectives. And not one is the correct one. There could be multiple ways to address the situation, but you have to be willing to hear it. And so conflict resolution really allows for that. And it's a skill because everybody likes to think that they're right. But it is a skill to actually hear the perspective of those that you are working with. So we do talk about that. And this is where a lot of times I get the, well, what about this? Well, what if this happens? Or I experienced this, how should I handle this? So this is a really great topic for letting people be heard, letting them explain what they have experienced and they didn't know how to handle it exactly. We do talk about common conflicts in the workplace, and everybody has different ideas about what the most common thing is. But a lot of people feel like there's a level of disrespect, whether it's how they are talked to or how they see other people talking amongst each other or to each other. And so we really focus on, well, we have to start with respect. What does that look like? That means hearing somebody out. That means identifying, well, I'm uncomfortable with this. And I would like to talk about how we can go about doing this job, this particular thing that we have to get accomplished without feeling uncomfortable. A lot of people shy away from conflict, and conflict is healthy. It's normal. It's going to happen. And instead of letting it go and letting it go and letting it build up and turning into something huge, it's really important to address that. So that's another thing we have to really focus on, not letting something get to you and then letting it build up and then exploding. So we do talk about that. And then probably for employers, the most important is how their employees receive feedback. One of the biggest complaints that I've heard of from organizations that I work with is, part of my job as the manager, as the person who's hiring, is to make sure that they understand what they're supposed to do. And when they don't meet those expectations, and we have a discussion about it, they get offended and they get angry and they quit, or they want to leave, or they respond in a completely inappropriate manner. And so for me, as an outsider to the organization, it's very easy to say, okay, well, let's talk about it. What is the job? What were you supposed to do? And to have them actually listen, and go over what it is that their job description really is, it's really easy for them to see, yeah, I didn't do that. I didn't cover all of that, but, and that's where we get into the crux of it. Let's take a look at, well, what's the reason? And a lot of times that I was running behind or I had an issue. And so that's when we talk about, well, we could have avoided all of this with a little bit of conversation, with a little bit of communication, with a heads up to your boss, asking for help when you need it. But most importantly, I think for anybody who works underneath somebody else, is if somebody is taking the time to give you feedback, they recognize that you have the potential to do even better. And so if you go into a conversation like that, knowing that they see that you can be better, and you handle that feedback well, that constructive criticism well, they'll think about that later on down the road when it's time for a promotion. You know, Anne Marie really handled it well when I told her that I wasn't pleased with X, Y, and Z. She fixed it. She listened to what I said. She didn't argue back. That's the kind of person that employers want to keep on or promote. So we do have those conversations as well. And then the last part under conflict resolution that we discussed is advocating for yourself. And that doesn't mean going to complain to a manager. That can be, I want to do well in this career, and so I need to find somebody who can mentor me or give me advice. That means I want to do the best I can, but I'm kind of unsure. That means I'm going to ask questions. A lot of young professionals are nervous to ask questions because it makes them seem, they feel like it makes them seem as if they're incompetent. And I have to mention over and over, no, the only way you're going to learn is to experience. And part of that is to ask questions and get feedback so that you can be your best self as an employee. So that is the conflict resolution piece, kind of in a nutshell. Communication is the second largest conversation topic that we have. I've heard from employers that one of the biggest concerns that they have is the informal or the familiarity that comes along in the position. And so we talk about in these workshops that there are times to talk like you're amongst your friends, and there are times to talk in a more formal way, to communicate and interact in a more formal way, unless you are directed otherwise. And the workplace is not the time to be gossiping or joking around. It's inappropriate. And there needs to be a strong focus on the objectives of the job. And when you are too informal, it makes you look unprofessional. It makes you heard as unprofessional. And we all want to be taken seriously. And so the best bet is to communicate in a way that is more formal. That doesn't mean, you know, old English language, but it does mean that, you know, slang is not included. Calling somebody by their first name is oftentimes frowned upon. So until you are directed otherwise, I always advise when you communicate, you want to speak to somebody with respect. You want to speak to them in, you know, a Mr. or Mrs. or Doctor, that type of situation, unless you are otherwise directed. The principles of communication, tone. It is amazing how tone will impact how you are perceived. So we talk about that. Empathy is also important. Clarity. Are you talking just to talk, or are you talking to, you know, is there an end? Is there a goal with what it is that you have to say? You know, we've all had those meetings where like, this could have gone in an email, right? But a lot of times the problem with the email is the right tone does not come across. The clarity that you need in order to move forward is not always met in an email. And then the last part of that is adapting. If you are in a situation, especially with folks who are older or elder, they like to be called, you know, Mrs. Shepherd. And a lot of times having a conversation with somebody and um, calling them by their first name is going to be problematic. This is just a little example. So it's easy to adapt and just call them Mrs. Shepherd to avoid any drama, any problems. It is important in any role that you have a little leeway. You can think outside of the box and that you can adapt to whatever the situation is. Because a lot of, from my understanding, what you all do in healthcare requires thinking on your feet and being able to adapt to different situations. And that is going to include the communication as well. We talked about constructive criticism. That's a part of communication. Active listening. Again, I think in the age of cell phones and computers and constantly being in front of technology, oftentimes conversations are not as productive as they could be because we don't practice active listening. Look at the person who's talking to you. Show some signs that you are hearing what they have to say, nodding your head, asking a question. It allows the person to know that you respect that they are communicating with you and that you are hearing what they have to say and that you are actively engaged. That is really, really important. And then we talk about some barriers to effective communication, and that can be anywhere. You know, I didn't like how they were talking to me, and so they just, you know, shut down. Um, Again, letting problems build up to the point that there is going to be a meltdown is definitely going to affect how communication occurs. Thinking that you're always right is going to be something that leads to poor communication. So all of these things we talk about, there are examples we go through and have conversations about, you know, how we can be better in how we communicate, and everybody can always improve. That's from, you know, the top down, the down, you know, from the bottom of the way to the top. But communication is a very, very big one. And then another area that we cover is cultural competency. You know, it's a diverse world, and diversity. Normally, we hear diversity and we think, you know, race, but it's so much more than that. It's political affiliations. It is age. It's gender. All of those things. It is, you know, the ability to walk versus being in a wheelchair. Diversity is everywhere, and how you communicate with somebody who is older is sometimes different than how you will communicate with somebody who is younger. And so being aware that diversity exists and walking into a situation that may be a little bit unfamiliar doesn't mean you have to freeze up and kind of freak out. It's important to identify that there is diversity. It's okay to see that people are different, and then interact as you normally would. And if you have questions, it's important that you ask them in a respectful way. And that is where the whole cultural competency part comes. It's recognizing that there are different cultures that are out there. And, you know, if you have a question, well, why do you do this? Or you know, why don't you want me to wear shoes? Or, you know, there's so many different things. I didn't realize that taking your shoes off coming into the house was a thing. When I was growing up, you wore shoes in the house. And then, you know, one of my friends, it was, no, you take your shoes off. You're bringing outside inside. That was completely outside my realm of experience. And there are so many different little cultural things like that that exist that maybe we don't appreciate enough or recognize, and that can lead to some really bad communication if we don't recognize it or ask questions or try and respect it as best we can. And then the last thing under cultural competency is really doing what you can to recognize that you can be the change. You can be a representation of a young person or an older person or a person of color or you know, people have all these biases and these ideas about groups, different categories of people. And at the end of the day, as a worker, you are representing not just yourself, but your company as well, your organization as well. And it is important to be as open as possible. And a lot of times when people go into work, they don't think about those things, but it should be something that employees are mindful of. And so those are things that we talk about in the cultural competency piece. So whenever a workshop is put together, It is completely tailored. What one organization might be seeing that needs to be developed or worked on in workforce can be completely different than another organization. So what I just went over are different topics that generally do need to be covered. However, the subtopics within those things are, open to whatever it is that you may need. It would be completely tailored, and so I would create several questions and ask for your responses. You are the ones who are educated and working with new hires. You know what you need, and so however it is that I can be of help, I would be glad to do that and make it super specific. You're not going to get the same thing that another organization is going to get. There's a general overview, but whatever it is that you recognize in this moment, this is what we need, this is what we're seeing, these are the deficiencies, those are the areas that we would really focus on. Workshops include differentiated instruction. That means there is going to be a visual, there is going to be information dissemination, there's going to be activities, there's going to be conversation, there's going to be movement around the room. So everybody is a different type of learner, right? So it's important to make sure that all of those different areas are hit so everybody gets the most out of it that they can get. And, they're appropriate for new hires as well as those who've been employed over a period of time. Oftentimes when I'm out driving, I'm like, there are some people who need to retake their driver's test. It's the same thing when you're working. When you're working, a lot of times you get so caught up in how you normally do things that you're not really open to the new thing. So just a heads up, the material is definitely workable for new hires and those who've been around for a little bit as well. So that covers what I was going to say.
Thank you so much, Anne-Marie. That was fantastic information and a really good overview. Now I'd like to turn it over to everybody else on the meeting. Please let me know if you have any questions. Come off of mute and go ahead and ask Anne-Marie. So just so everybody on the call knows, I've mentioned it in some of our monthly meetings with the long-term care organizations. We've been working with Anne-Marie for some time now on some different workforce development initiatives. And I can't say enough about the fantastic feedback that we've received about her program. As she just mentioned in her last slide, she customizes, she's got a core foundation of what she thinks is a good starting point for this type of a workshop, but she also customizes it for what you're specifically looking for. So I know we've talked to a couple of different individuals about what that might look like. But from the feedback we've heard from the long-term care organizations that we're partnering with on this program, there is a lot of need for looking at how can we support, especially those entry-level individuals who are really new to the workforce, who might be new to a healthcare career. How can we best set them up for success? And I think this is really a component that that a lot of you are touching on. So please feel free to ask any questions you might have of Anne-Marie. And if not, we certainly can provide her information so that you can contact her directly, as well as we'll be sending out a copy of this deck in case you'd like to share that with others in your organization. And as always, we'll be putting this recording on our FLPPS YouTube channel. Any other questions? Let me just check and see if there's anything in the chat.
Perhaps, why don't we just take a few minutes? Anne-Marie, do you want to share the monthly workshop that you provide for home health aid candidates that are hired by HCR Home Care and Rochester Regional Health, and who are all trained in the same they're all enrolled in the same training program, although they're hired by different organizations, right? Can you just share just a little bit about that 4-hour pre-employment workshop that you conduct?
Yes. So they normally come in, I'm just gonna be honest, they normally come in and they're like, oh Lord, 4 hours, we have to sit here, right? That's normally kind of the look that people have when they come in. And I understand it, I get it. But again, one of the things that I like to do is try and keep things as, open and conversational as possible. And in order for it to really work, I have to get feedback as we're talking, so I can really focus on the areas that they think are important too. I know the employers have a very specific idea of what they want to cover. And as we're talking about things, it's really important that the people who are participating are also feeling heard. So I almost always start off with time management, and across the board, ask the question, if you had a full day to do whatever you wanted, and you had all the money in the world at your disposal, what would you do with that money? And that automatically, everybody has an idea about how they can spend all sorts of money all day long, in a one day period. And then after we get through that, it kind of gets them talking, but then we discuss about how your time is just as important as money. And so it is really important that you are utilizing your time in the best way. And it's not that, where are my shoes? And I can't find this. And, oh, I forgot to send this email. It is really important to be on point with your time. And again, so much of what makes these workshops really productive is the fact that there's feedback, that there's conversation. And when I tell you the time management, I start with time management, and my ideal amount of time for that is about 40 minutes. And when I tell you that that has always been about an hour and 20 minutes, and I have to shut it down, and I give them an opportunity to give me feedback, and what are things that you would change, or what was not as needed, that kind of thing. They always talk about the time management piece needs to be a little bit longer, because we all have cell phones, right? And there are so many tools on the cell phones that help time management. So anyway, we start with time management. And then one of the things that they always want to talk about is the communication piece. A lot of people really feel like other people don't know how to communicate well. And so we come up with a lot of different examples. They give it to me as real life examples in a workforce situation, especially in a home health aide situation. Some of them have been in the field, have not done like a recertification, and so they have to take the course again. And one of the things that they have talked about consistently is, when I come in, somebody was supposed to have made sure that the bed was made and the counters were cleaned off, and that wasn't done when I came in. And on one day it's okay, but if it's consistent, it's a problem. And how do I say that without sounding like I'm better than they are, or without, I want to yell at them. I've got things that I'm supposed to do and they didn't do their part. So we have a lot of, that's just one little example, but we have a lot of specific questions that come up. And how do you think I should handle that? And what's interesting is, I'm a person who's facilitating the conversation, but I am in no way the expert on all things communication. And it's really interesting, in every single class that I have done, the way that the rest of the classmates will come in and offer, well, when I experienced that, this is what I did. And there is I don't want it to sound hokey, but there is a sense of camaraderie among them, in that I've experienced this. You know what will help? Try this. And I think that's wonderful, because not every profession is willing to lend their tips and tricks, that work. So the communication piece is really one of my favorites to participate in. And so many people, the age ranges are really interesting. I thought that it would be mostly really young people, but it's not. It's all ages. And the way that the more experienced, more seasoned people handle things versus how the younger people handle things is a really interesting kind of dynamic, and they feed well off of each other. But again, with this particular group in the past 5 months, I've really noticed that they work well together, and they, well, have you thought of this? They give a lot of advice. And so it's been really, really effective for the communication piece. Again, all of the different, yep.
Yeah, no, thank you. Yeah, thank you so much, Anne Marie. And so I want to mention to all of you too that we being at FLPPS, we have budget dollars to go toward paying for these customized workshops for your programs. And so a workshop, as Anne-Marie has described, that she currently conducts for home health aid candidates, a similar workshop can be designed for your workforce, and FLPPS has the budget dollars to cover the expense. So the cost of these workshops would not go through your ARPA award dollars that you have access to support the development of your workforce development programs. These workshops are outside of that. So I want to make sure I mention that. So maybe we'll get a lot more interest because you don't have to pay for it. But what we'll do is Christina will send out this presentation along, and we'll include Anne-Marie Shepherd in the email, so that you have her email, you have this information that she presented today. And I hope you'll reach out to her and see what may work for your organization, where you may want to have her focus her time on further develop and expose your workforce too. So any questions, thoughts, comments?
Hey Marie, I
Yeah.
I love your content. I think it's fantastic. I think it's significant. It's meaningful. It makes a difference. This is a bit of a hard question, and I totally would understand if you don't have a direct answer for this at the moment. Have you seen anything that's causing? Are you familiar with the term "no call, no show"?
Yes.
Okay, so for instance, rewind like 10 years ago. Maybe we schedule like 10 interviews. 8 people show and 2 people don't, right? I feel like something happened over the course of a few years here where those numbers have flipped. It's almost a majority, in some stretches a super majority, of just the simplicity of having everything lined up and an individual just not showing up. And I don't know if you've done any research or you know of any trends, but it's sometimes it's just perplexing, and it's like I just can't fathom like just not following up with someone or saying no, I've changed my mind. Did you have any sort of analysis on that?
So, not in, an official capacity, but what I have noticed, it's funny that it's funny that you say that. There is a sense. I have seen a sense of entitlement almost, where, well, of course I would be offered a job, of course I would be granted an interview, and of course I would get the job. I don't know what that trend would be called, but that is very real. Also, I think there is a fear in that I need to have my options open. And so when they apply for something, oftentimes there are multiple applications going out. And even if they get an offer, well, somebody else might be paying, 25 cents an hour more, or, something along, offer a benefit here, and I applied at the same time and they gave me the best offer. And some of it, I have to be honest, is what I like to consider home training. A lot of things that were taught in earlier generations just are not taught. And that is not just parents, but also schools as well. The idea of being accountable, in somebody puts time aside to talk with me and I just don't show up, that's not discussed at all. And so I hope that kind of answers your question a little bit. Again, in an official capacity, I can't say for sure, but I have seen those few things that I do think impact the no call, no show.
Thank you, Anne-Marie. I appreciate that.
You're welcome.
Thank you so much for your comment. I think it's very relevant. And just to add on what Anne-Marie was saying, like we had said, she's involved providing this pre-employment workshop to a home health aid training program that we're involved with. And we actually have scheduled her class about a week before that training, the core training starts for the home health aid. And we did that really because we had feedback from the home health care agencies saying that there's some onboarding that has to be done prior to being hired into a position like this, including a background check that takes a bit of time. And so what we've noticed is that the timing of this pre-employment class has really improved engagement. A lot of people were just like you're saying, just very flighty, no call, no showing, especially if there is a lull in the conversation while you're waiting for those candidates to get full clearance to be employed and then to go into this class. So it's absolutely improved engagement. It's got people excited about the training. It's kept them on the hook. And I can even report that individuals that have had to, due to personal reasons or scheduling reasons, had to delay taking their class for a couple of months. Those that attended the pre-employment training did stick with it, even though there was a delay in their being able to attend. So I don't know if that helps you a little bit, Mike, but we've definitely seen and heard from those that we're working with. No show, no call, no calls, no shows are huge. It's it's very impactful for everybody. But I think, adding in programs like this can be impactful.
Thank you, Christina.
Mm-hmm. Any other questions or comments? Well, thank you all for attending, and thank you so much, Anne Marie, for coming and sharing.
Thanks for having me.
Add, Catherine, before we let everyone
No,
off?
just appreciate everyone taking your time this afternoon, and we will follow up with you. Have a great afternoon.
Thank you.
Take care. Bye-bye.